Well, hello and welcome to our news conference hosted by Oakland University and BHSH System to discuss our new BHSH System Nurse Scholar Program. I'm Mark Geary, the Senior Director of Communications for Beaumont Health. We're going to begin with opening remarks from Tina Fries-Decker, who is our CEO of BHSH System. And from there, we'll go to Dr. Ben Schwartz, who is our President of Beaumont Health. And then we'll move on to Dr. Ora Peskovitz, who is the President of Oakland University. In addition to those three speakers, we have Ann Stewart joining us here, who's the Interim Chief Nursing Officer of Beaumont Health, as well as Judy Didion, the Dean of OU School of Nursing, and they'll be available to answer questions afterwards as well. We'll call on reporters after all of those opening remarks are concluded, and you can ask your questions. And for now, I'll turn it over to Tina.
Thank you very much, Mark. It is so great to be here to talk about our partnership with Oakland University too, and announce the creation of the BHSH Beaumont Health Nurse Scholar Program. As many of you know, when faced with health concerns, the nurse that cares for you is one of the most impactful and critical people on your road to recovery. Nurses care for people when they are sick or hurt and are equally dedicated to helping people improve their health and well-being. Nurses make a lasting impact, and they've made a lasting impact on my life as well. And this is why we support those with a passion to become a nurse and why we invest in opportunities to support their education. And today, we critically need more nurses in our country and in our communities. The nursing shortage here in our state is critical, and it's a complex challenge, and it must be solved with bold and collaborative solutions. So today, we are excited to partner with Oakland University to invest in and implement the innovative program BHSH Beaumont Health Nurse Scholars. This includes an investment of more than $20 million to create an opportunity for up to 500 additional students to pursue a career in nursing over the next 5 years. We are incredibly proud of our long-standing partnership with Oakland University and appreciate your leadership, Dr. Ora Peskovitz, and to have this amazing opportunity to invest in talented, compassionate people who want to become nurses. We know this program will positively impact healthcare in our communities, and we look forward to seeing the first student enter the program and also then join BHSH System. So now I'd like to invite Dr. Ben Schwartz to share some of the details of this innovative solution and the impact this will have for BHSH Beaumont Health. Ben?
Thank you, Tina. Hello, everybody. Since the COVID pandemic, there's been a critical shortage of nurses not just in our Southeast Michigan communities, but also in the entire state of Michigan. And Beaumont's enjoyed a really strong relationship with Oakland University for over 40 years. This partnership creates a stronger pipeline for us to train the next generation of nurses. We're going to use these funds to directly address the need for highly skilled nurses in the region. And it's a further demonstration of our commitment to this partnership with Oakland University and to the care that our patients need in our communities. We're looking forward to hiring more nurse students into roles. We've already had a great relationship with Oakland University. We have many of their graduates employed by us now. Their training is spectacular. And even in the most complex of clinical situations, they've done incredibly well. We know that there are many students that students have many choices regarding where they can work after they graduate. We're very confident that when they have a chance to see our spaces and work with our nurses and collaborate with doctors and others in our buildings, that they'll choose to work for Beaumont. And we're really excited to see the amazing things that are going to be happening here in the future. And with that, I'll hand it over to Dr. Ora Peskovitz.
Well, thank you so much, Dr. Schwartz. First of all, we really want to thank BHSH and you specifically, Tina, and you, Dr. Schwartz, for your incredible vision, your strong commitment to collaboration, and for your response to the healthcare needs of people throughout our region. On a basic level, this gift makes possible the essential ecosystem that really must exist across education, economics, and healthcare to enable our community's excellent quality of life. The way we look at it is this: we really need each other. And we also need to find new ways of responding to the needs of people throughout our region and our entire state. And we think that this partnership stands as a promise of what's possible. The Oakland University and BHSH partnership is also a model partnership. And we think that the way that we came together and focused on the inextricable connection between education and healthcare delivery and improving the quality and efficiency of healthcare is just one sign of how partnerships can truly become transformative. Given the realities of rising healthcare costs, aging demographics, and serious workforce shortages, we must form partnerships and look for innovative approaches to make sure that each of us is doing all that we can for the best health interests of our citizens. And so we're extremely proud of our existing relationship with Beaumont Health and the strength of the partnership that we already have that's been reflected in the extraordinarily high reputation of the Oakland University William Beaumont School of Medicine. And now we'll have some additional educational infrastructure to make sure that highly talented nurses are available and are able to provide additional high quality nursing care. We're so proud of what we're able to do together. And now, Mark, I'd like to turn things back over to you.
All right, thank you so much, Dr. Peskovitz, Dr. Schwartz, and Tina. Turn it over now to reporters. If you have any questions, you're welcome to put them in the chat or raise your hand. A reminder, we have Ann Stewart, who's our interim chief nursing officer at Beaumont, as well as Judy Didion available. Judy is the dean of nursing at OU. They can answer questions. Karen Bouffard from Detroit News, you get the first question.
Hello.
Hello. Oh, you muted yourself, Karen.
Okay. I'm just wondering where the funding is, where the money is coming from to fund this.
Okay.
Can you hear me?
Yep. Who can answer that question for us?
So there is funding from BHSH system that will fund part of the infrastructure investment. And then as we move forward with some financial support for some of the students. So this is coming from BHSH system.
Oh, okay. Is it just, I'm just wondering, you know, the mechanism within the BHSH system for funding it. Are these like dollars that were set aside when you created the part, you know, the merger?
No, these are dollars that we have strategically allocated because we really want to have a focus on recruitment and retention and investing more in people becoming nurses. And we're very pleased that we can partner with Oakland University, that they want to partner with us to create this unique opportunity to continue to educate and expand the spots so that we can have more nurses in the pipeline to become nurses after their education.
Okay, thank you.
Thank you. Channel 4. Paula Tutman, I believe, is on.
Yeah, hi, sorry about that. I don't have my 19-year-old to help me with my IT issues here. So, and I may have missed it because I had to walk away for a second. Did you discuss the mechanism? In other words, how does this work? And so who gets what? How do you apply? And then I also think you have a commitment to work at Beaumont, et cetera, et cetera. So can you just kind of give me the rundown of how this works, how much money is available, how this alleviates some of the rigors of finances, blah, blah, blah. There was a whole bunch in there, but I think you get my point.
Maybe I'll start and then turn things over to Dean Didion to provide some specifics. So first of all, let me just say that we, again, are extremely appreciative to BHSH for making this possible. We at Oakland University, and Paula, you know this very well, like to think of Oakland University as the university of choice, but specifically, we like to think of ourselves as the university of choice as the workforce university. And that's because in Southeast Michigan and across Michigan, we have a workforce shortage. And in particular, there's a workforce shortage for healthcare workforce. And so we want to be responsive to that workforce shortage. And particularly now we're addressing the nursing workforce shortage. And we recognize that there are not an adequate number of nurses. And the way to do that is to address it at the root cause, which is at the educational level. And in order to do that, we understand that we not only need to train more nurses, but we also have to provide an infrastructure part of the support. So I'm going to let Judy discuss the specifics, but half of the funding goes directly to our nursing students as scholarships, and the other half goes to the infrastructure at Oakland so that we can actually make it possible for us to train and educate these students. Let me turn it over to Judy so that she can give you a little bit more detail in how we do that. But I do want to emphasize this point about how much we want to be the workforce university so that we can continue to do things like this in the future. Judy.
Thank you, Aura. Paula, these are excellent questions. What we want to do in the next year is plan for the additional students in our nursing program. In order to take these additional students, we need to build resources that currently we don't have, and that's why we have a maximum at this point based on those resources. So some of those resources include expansion of our simulation lab, additional classroom space, additional faculty, full-time and part-time, as well as clinical placement opportunities for our students as they move through their curriculum. So with this partnership, we see the value of having not only the financial support for our students, but also the financial support to have these additional resources, and also to work with Beaumont to increase the number of clinical placements for those students as they move through their educational program. So these are all requirements that we will need to meet in order to maintain our current accreditation, as well as working with the Board of Michigan and with our approval status. So we're not taking additional students without having the resources that they will need to succeed with their education. So the money that will support the infrastructure will help us build that within the next year. So then we can start to admit students. And we are going to work with Beaumont and Spectrum in terms of developing the eligibility criteria for that scholars program. Also to provide the information that those scholars will need to understand that this scholarship is will support them as they move through their educational program, but there will be a commitment for them to work at Beaumont for up to 2 years post-graduation. So I'm real excited to work with Anne and her nursing staff to start developing some innovative educational processes in the clinical side, but also to help these scholars on board while they're in their educational program and have a sense of belonging at Beaumont. So when they graduate, they will be able to move much more smoothly and transition into that registered nurse role and retain their employment at Beaumont post 2 years. So these are the goals we have in mind. Our intention is to add 500 students to our current enrollment over the next 5 years. So as we plan for this and build those resources, we will start to, we will also have a recruiter advisor hired on just specifically for the purpose of recruiting students for this scholars program. And then, working with them as they move through their curriculum. So there's a lot of planning ahead of us, and we look at a 12-month process in terms of actually building this infrastructure. But we want to make sure everything's in place so that those students will succeed. And then, of course, we will still have our current students. So this is a really exciting adventure for all of us. And we will look forward to working with the nurses at Beaumont to facilitate this as we build out this program. And I don't know, Ann, did you want to add anything to that?
Yeah, I was actually, thank you, Judy. At Beaumont, we are ecstatic about this opportunity. We love to bring students in, to mentor our new nurses. And this is just an opportunity to share more of our knowledge with more of our up and coming nurses. It's just, we are thrilled. And again, as a partnership with Oakland University, we've had a great relationship with this university as well as many of our other affiliations. And again, one of our goals is to continue to bring our nurse students in, give them great clinical experience so they become excellent clinical nurses like we already have at Beaumont.
Yeah, thank you, Ann. And I just want to emphasize, Paula, that, in nursing education, we cannot exist in a silo. We need our practice partners really to provide the education these individuals need to become professional nurses. So these academic practice partnerships are key for quality education. And this commitment, this gift from Beaumont Health, Spectrum Health is really, not only is it a wonderful gift for us, but I think it represents a commitment nationally of how health systems working together with universities can create a workforce that our community needs right now, because the shortage is affecting our ability to provide quality care, and we don't want that to slip. So having partnerships like this will allow us to be part of the solution for the shortage that Beaumont is feeling right now. And I think it's a wonderful opportunity for us.
All
Thank
right.
you.
Wonderful. Chris Hall from the Detroit Free Press.
Yes, thank you. Can everybody hear me okay?
We can.
Thank you. I had just a few questions, and one of them follows up on the question or the comment you just made. Can you talk about the numbers of nursing shortage here in Michigan and specifically at BHSH? And then I had a couple of questions about the nurses coming out. Once they go into work, will they be either at a Beaumont or Spectrum hospital or facility? And then can you talk about the scholarships? How much will those be? How much will that cover for the students? And when would they actually start their education at OU? Thank you.
And do you want to start with the shortage at Beaumont?
I can talk generally about the nursing shortage. I think it's a national nursing shortage. We are all aware that we have struggles in healthcare. Post-pandemic, many of us have been nurses a long time. We've been hearing about a nursing shortage coming for 30 plus years, and that pandemic kind of threw us into a shortage a little quicker than we expected. We do have shortages, and this is why we are trying to do many different things, including this great partnership to bring more caregivers to the bedside. We do have open positions, I think no different than any other system in Southeast Michigan or in the United States. This is a national challenge. We take great care of our patients. Our nurses do wonderful taking care of those patients, but we need more of them. That the pandemic changed the face of healthcare. We had nurses that may not have left their career at that time, but they decided they didn't want to risk their health. So I think there were so many different factors that impacted where we are today, and we have to be nimble. We have to look at different things. We have to try many things to bring these caregivers back to really what is probably the most fulfilling job that anybody could ever have. I always talk about, not many people in the world every day when you're doing your job have somebody say, thank you, thank you, thank you. Our patients and their families and their loved ones appreciate every bit of care and work we put into taking great care of them. So that's that question. And I apologize, Chris, I missed your second question. I think
That's okay. This was about the nurses in the program. Do we know how much their scholarships would be, or how much that would cover for tuition, and when they would actually begin their education at OU? I know there was a year of building, and then once they graduate, will they be placed in either a I know the system is merged now, but could they be on either side of the state practicing?
So Judy, you want to take the second and then I can take that next one?
Chris, these, I get the last question and I forget the very first, but I'll try to talk about the scholarship. So we're looking at half of the funding, $10 million for 500 students. But I have to say that the scholarships would vary based on the students' current scholarships. We have multiple scholarships in Oakland, and some of those are merit-based and some are based on other eligibilities. So what we would try to do is offset those scholarships with this scholarship. And we're looking at students who are entering into the major. So we have two tracks, I should say, for our baccalaureate program, pre-licensure program. One is a traditional track where students would come in for a year and take their prerequisites and then enroll into the nursing program their sophomore, junior, and senior year. We also have an accelerated second degree program where students who have a bachelor's degree in a different field and want to change their career come to Oakland to become registered nurses, and it's accelerated over 16 months. So that would probably, those scholarships would be tapered according to which track they are in. They won't be full scholarships for all 4 years or for all 16 months necessarily. So I don't want to commit to that, but I just want to say that as students come in, we would look at them individually and what their financial status is and try to offset so that they're, you know, not having the loan burden that we see some students graduating with. So this scholarship is really important. Not only it will incentivize and help to support these students as they move through. The other piece about where they'll go, the commitment, this scholarship, you know, I will be working closer with Beaumont about this, but it was my understanding this focus would be for Southeast Michigan. And the student commitment would be in the Beaumont health systems within this part of the state. And what we also want to do with this scholar program is to focus on, you know, a variety of student needs and placements so that we can help Beaumont as they try to place students not only in the northern part of the Southeast Michigan area, but in the southern districts, also some of the hospitals south of Detroit that are also struggling with the nurse shortage. And as Anna had spoke, this shortage is national, it's statewide. There's many health systems are concerned about this. And I want to add that this opportunity is to add students to our current program. So we do supply a lot of the workforce in our area to multiple systems, but this will be additional students who will be scholars for Beaumont. And I think it's a very innovative approach to solving the shortage problem. And hopefully it will bring us closer to this practice partnership so that our students will have a very much more rich educational experience.
Yeah, and as Judy said, really our intent is for these students to be in clinicals in our 8 hospitals. We have a variety of hospitals through Beaumont Health. We're very fortunate when you have 8 of them. And some are smaller community, some are larger community, and some are academic hospitals. So we think we're going to be able to offer just a variety of experiences. And hopefully they will, when they're done with their schooling, and they will want to be long-term career Beaumont nurses. We have many of those already, and that's our goal, is that we give them a great work environment, that they want to stay with us long-term, caring for our patients and our communities.
All right, wonderful. We have time for just maybe 1 or 2 more questions. I see Karen, do you have an additional question from the Detroit News?
Yes, hi. I'm wondering how the funding will be distributed across sort of the, you know, the course of education from people that are just entering at the RN level through like nurse practitioners, people that want to be nurse practitioners. Is it going to be all kind of the first stage of education of nursing, of getting an RN, or are there going to be people funded for like master's degrees and so forth too?
Karen, at this point, this is for new nurses. So we call this pre-licensure. This money will support our students who are not nurses already, but want to move into the profession. So, and this is where Beaumont has identified as their need at this point, is they need new nurses to come into the workforce. So the funding will be there.
Thank you.
And by the way, I mean, you know, we are open to trying to be, that was my point initially, being responsive to where the workforce needs are, whether it is in nursing or other areas. So we stand ready to be responsive to Beaumont or others to respond to wherever the healthcare needs or other needs, workforce needs are in the area.
All right. Well, thank you everyone for joining us today. I'm going to turn it back over to Tina Fries-Decker for some closing remarks.
Thank you very much, Mark. And I just want to say my appreciation and thank you to Ann Stewart, to Dean Didion, to Dr. Ben Schwartz, to Matt Cox, and to Dr. Ora Petskovitz, and everyone at BHSH, Beaumont Health and System, as well as at Oakland University. You know, Ora, you lead with an approach of collaboration and partnership and boldness. And because of that, we were really able to come together. And I am just so grateful for this long-standing partnership that we have with Oakland University, and are very excited to expand opportunities to talented and compassionate people who want to become a nurse and to have that huge impact to the people that we serve. This is the definition of a win-win. We are helping people realize their dreams for themselves, while at the same time setting up our organizations and our communities for success. And ultimately, I think as Ann said it earlier, the goal is better health for all the people that we're serving. So I'm very grateful for this. I look forward to the future in partnering together and expanding nursing opportunities for many others. Thank you so much for joining us. Mark, I'll turn it back over to you.
Yeah, thank you, Tina. And thanks again to everyone who joined us here today to hear this exciting news. If you have additional questions, you can reach out to the Beaumont Media Relations team or the OU Media Relations team. Everybody have a great day.
Thank you.